exoskeleton, as the name suggests, is an external frame that can be worn to support the body, either to help a person overcome an injury or to enhance their biological capacities. Powered by a system of electric motors, the frame gives limbs extra movement, strength, and endurance. The Restore Exosuit is a brand new kind of robotic gait training solution for clinics. Unlike a traditional exoskeleton, exosuits are made of soft, flexible fabrics and do not contain rigid supporting structures that can restrict movement. This allows the exosuit to provide targeted assistance that synchronizes with changes in the patient's own gait, making the Restore exosuit a perfect fit to help retrain walking function for patients in rehabilitation programs after a stroke or after severe leg injuries. This is a sure bet for your recovery process. The goal of any laboratory microscope is to produce clear, high-quality images, whether an optical microscope which uses light to generate the image, a scanning or transmission electron microscope using electrons, or a scanning probe microscope using a probe. The upright microscopes are the most common type, with the lighting system below the stage and the lens system above. Inverted microscopes, particularly useful for cell culture, reverse this configuration. Applications include biotechnology, pharmaceutical research, nanophysics, microelectronics, and geology. Commonly used compound microscopes are usually binoculars, that is 2 eyepieces, and use multiple lenses to produce a 2D image. They can achieve a maximum of about 1500 times magnification and are popular for use in biology and in forensic labs. The stereo microscopes offer 3D viewing at lower magnification and are available in fixed and zoom variations. Digital microscopes eliminate eyepieces, combining optics with a CCD camera to view images on a computer screen. Techniques range from simple bright field to dark field, phase contrast, differential interference contrast, confocal, that is useful for thick specimens, and fluorescence microscopy, which continues to prove its value in areas such as cell biology, genetics, and embryology. The use of polarized light in polarizing microscopes results in increased image contrast. An anesthesia machine is a pneumatic device that supplies a mixture of oxygen, gas, and anesthetic agents to a patient, allowing them to remain unconscious but breathing during surgery. The device delivers oxygen while simultaneously ensuring that the patient does not inhale the life-threatening CO2 they previously exhaled. Surprisingly, however, the anesthesia machine's design has remained relatively the same since its invention. The essential components of an anesthesia machine include the ventilator used to keep the patient breathing during surgery, the breathing circuits to keep the air and gases flowing to and from the patient safely, scavenging systems to remove the used gases such as CO2, and safety mechanisms to ensure a patient's well-being in the case of an emergency. An anesthesia machine has many alarms that inform the medical team when a patient might be entering a critical or dangerous state. When a patient is connected to a ventilator during surgery, these disconnect alarms are activated. Anesthesia workstations boast at least 3 disconnect alarms, one that informs the team of low pressure in the breathing circuits, a second that notifies of a low exhaled tidal volume, and a third that cautions of low exhaled carbon dioxide. Each of these states could mean that the patient is in danger. Thus, doctors must closely monitor them to ensure the safety of the patient during surgery. The birthing bed is a medical facility that is made to be multi-purpose. Typically, a doctor will ask a laboring mother to use a birthing bed at the very minimum to sit on or lay on when they need to be examined or monitored. In that case, it helps the medical personnel as much as it helps the mother. Birthing beds are made to support mothers as they sit. This can often be more comfortable for them than laying down on their backs. Mothers can also support themselves and lean over the birthing bed. Sometimes standing can actually help unborn babies descend in the birth canal thanks to gravity. But then, some mothers appreciate being able to balance on a birthing ball, and the bed gives them the support they need there as well. Mothers are able to squat while using the bed as support and can get on their hands and knees and labor on top of the bed. These beds are not flimsy and are made to support mothers as they give birth, as well as during the immediate recovery period. These beds are often outfitted with padding as well as stirrups or other apparatuses that will help during the final stages of birth. There are so many benefits to having a hospital birthing bed available, even if it isn't the most important part of a woman's birthing experience. Every birth is different, but these beds should be made available to hospitals at large. A C-arm machine is an advanced medical imaging device based on X-ray technology. They are primarily used for fluoroscopy capabilities, although they have radiography capability too. C-arm is called so due to its C-shaped arm, which is used to connect the X-ray source on one end and the detector on the other. C-arm machines are widely used during orthopedic, urology, gastroenterology surgeries, other complicated surgical pain management and emergency procedures, cardiac and angiography studies, and in therapeutic studies including stents or needle placements. The fluoroscopic technology enables high-resolution X-ray images provided in real time so that the surgeons can do more accurate procedures with better outcomes for the patient. C-arm systems are also mobile and provide a great deal of flexibility to the surgeon to take images of whole body of the patient from different angles as required. This is a sure bet for your next project. The automated external defibrillators, known as AEDs, are portable life-saving devices designed to treat people experiencing sudden cardiac arrest, a medical condition in which the heart stops beating suddenly and unexpectedly. A combination of CPRO, known as the cardiopulmonary resuscitation, and early defibrillation is effective in saving lives when used in the first few minutes following collapse from sudden cardiac arrest. AED system includes accessories such as a battery and paired electrodes that are necessary for the AED to detect and interpret an electrocardiogram and deliver an electrical shock. There are two main types of AEDs: public access and professional use. The public access AEDs can be found in airports, community centers, schools, government buildings, hospitals, and other public locations. They are intended to be used by lay people who have received minimal training. Professional use AEDs are used by first responders, such as emergency medical technicians, known as EMTs, and paramedics who receive additional AED training. A medical linear accelerator known as LINAC is the device most commonly used for external beam radiation treatments for patients with cancer. It delivers high energy X-rays or electrons to the region of the patient's tumor. These treatments can be designed in such a way that they destroy the cancer cells while sparing the surrounding normal tissue. The LINAC is used to treat all body sites using conventional techniques, intensity modulated radiation therapy known as IMRT, the volumetric modulated arc therapy known as VMAT, the image guided radiation therapy known as IGRT, and the stereotactic radiosurgery known as SRS, and stereotactic body radiotherapy known as SBRT. The linear accelerator uses microwave technology that is similar to that used for radar to accelerate electrons in a part of the accelerator called the waveguide, then allows these electrons to collide with a heavy metal target to produce high energy X-rays. These high energy X-rays are shaped as they exit the machine to comfort and conform to the shape of the patient's tumor, and the customized beam is directed to the patient's tumor. The beam is usually shaped by a multi-leaf collimator that is incorporated into the head of the machine. The patient lies on a movable treatment couch, and lasers are used to make sure the patient is in the proper position. The treatment couch can move in many directions, including up, down, right, left, in and out. The beam comes out of a part of the accelerator called a gantry, which can be rotated around the patient. Radiation can be delivered to the tumor from many angles by rotating the gantry and moving the treatment couch. What other medical facilities and equipment do you think will boost a patient's recovery and lifestyle? Let's hear your thoughts in the comment section below. For more of our content on new inventions and technology, please click on the subsequent videos on the screen, and don't forget to like and subscribe to our channel. Thanks for watching.